You know, people have thought for a long time that not allowing some people to access health care because of cost was indeed a moral issue. And I must say, I think that sentiment is correct. I think what we didn't fully understand back in 1993 and 94 when we debated this before was just how serious our rationing of care by income, which is what our situation today really is, how serious it was. In 2002, the Institute of Medicine released the result of a long study that suggested that about 18,000 Americans die every year because they don't have access to timely care, which they would have had they had normal, not Cadillac, just normal garden variety health insurance. And they died because they didn't get seen in time, they didn't go when they should have gone, they didn't go because they were embarrassed they couldn't afford it. And they end up being seen too late, and even the best and most courageous and heroic and sometimes expensive efforts pro bono on the part of some providers couldn't save them. Now, if you think about it, 18,000 people dying every year because they don't have health insurance, and you do the math. We stopped debating health reform before in 1994. It's basically been 15 years before we took this up again. In those 15 years, we've lost close to 250,000, 300,000 Americans from not having access to health care and health insurance, which would have enabled them to survive. Now, when you think about it that way, it makes you think, what kind of community is this? What kind of society allows this sort of thing to happen to its citizens? And that makes me think, you know, in some ways it's a question of what kind of community do you want to have? And I would submit to you the best descriptions of community are the oldest descriptions we have. And I'm talking about the Hebrew prophets. I highly recommend you go back sometime and read chapter 23, verse 22 in Leviticus, the third book of the Torah, where it says, when you harvest your field, you got to leave a little bit in the corners for the poor and the alien. That was the third book of the Torah. In the fourth book, Moses said, widow, orphan, stranger, and that's the phrase we like better and the one we use today. Everybody had a better fourth draft than the third draft. You had a better phrase. Widow, orphan, stranger. Let's decompose this. Widow and orphan makes perfect sense from an economist's point of view. Life expectancy was 32. You had to be an adult male to own land. So if you didn't feed and have a claim on food, if you didn't feed your widows and orphans, you could possibly wipe out a whole tribe very quickly. That's perfect self-interest. The key word here is stranger. You're expected not to be Jewish, not even to be local. So you had no ties to these people, but you had an obligation to keep them alive. Why? Because the belief was profound that every human being was made in the image of God, and every human being therefore had the right to participate in the life of the community. And it was the obligation of the community to make life possible. Preventable starvation was an unacceptable violation of the covenant with God. Even starvation among the alien, even starvation among the stranger, among someone who did not share your ethnic or religious ties. Then Jesus came along about 1,400 years later, and whatever else you may believe, he certainly is credited with making clear the universality of the concept of the stranger. And he did that by eating with and teaching prostitutes, tax collectors, lepers, people who were considered outcast and unclean, excluded from the society in which he lived. He made clear the universality of stranger. Mohammed, you may not know, 600 years after Jesus, who, by the way, learned his theology from the Jews of Yathrib, the town we call Medina, and the Christian monks in the Sinai, used almost the same language, widow, orphan, stranger, translated today from the Arabic as wayfarer most often. But the basic concept is the same. That is, you must feed the hungry. You must take care of the needs of the vulnerable in your society. Otherwise, you don't have a real covenant with your God. You don't really have a society you want to be part of. Well, I submit to you, food was so central then because food was the one thing one human being could give another to guarantee life. Healthcare has become like food, a unique gift capable of sustaining and enriching lives stricken with illness, which, after all, could be any of us. Tomorrow, we could all get cancer tomorrow. Therefore, in a fundamental sense, we are all the stranger, just as the ancient scripture taught us to think about it. So, if you think about it that way, to deny health insurance because of cost, and therefore to deny access to life, is sort of like denying food when Moses taught. So when you think about it, health care should be something the community makes sure that every member of the community has access to.